melanoma is a complex disease, and the latest updates are the following. Basically, we know the numbers. If a dermatologist sees 10 melanomas per year, 7 of these 10 melanomas will be easy to be diagnosed. 2 melanomas will be easy to be diagnosed dermoscopically. So if we use our dermatoscope, it will be easier to recognize 2 of these melanomas. And now we are 9. And the last one, it will be possible to be diagnosed only if we monitor our patients with multiple nevi over time. One of the specific and most difficult to be diagnosed melanomas is the so-called amelanotic melanoma, so where you have no pigment, so it's a pink lesion. And in this context, the difficulty is because we miss the classic criteria that we find especially in pigmented melanoma. But we have some rules to follow. First, amelanotic melanoma is usually a nodular lesion, so we should excise any type of nodular lesions where we don't know exactly what kind of benign lesion is this one. The second point is that if we use our dermatoscope, we will be able to see polymorphic, irregular, crazy vessels, which will help us a lot to understand the correct diagnosis. And the third one is concerning the residual pigmentation. Even if a lesion clinically by the naked eye is looking completely non-pigmented, if you look with your dermatoscope, you will still find some pigment. And here it comes the clue. So by looking to our dermatoscope, we are able to increase our ability to recognize this very difficult type of tumor. My take-home message concerning melanoma is that definitely we can be optimistic in terms of diagnosis of this kind of tumor because we improved a lot in the last few years. Of course, there are things which are also important, like please take a look at the entire skin of your patients, because sometimes we are not able to see a melanoma only because we don't check a particular area of the body of our patients. And secondly, try to keep your waiting lists short, because if my waiting list is 6 months, for example, how can I do early diagnosis of melanoma?